Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We usually host these forums every Tuesday and Thursday at 9 a.m. Today we're doing it a little bit late because there was a lot of weather last night in Pembroke and a lot of outages, and they're still there, unfortunately. You can watch in Pembroke on Comcast Channel 15 or online by going to our streaming channel by visiting pactv.org/live. To ask questions during this forum, please email them to pembrokeinfo@pactv.org. For the forum replay schedule and additional Pembroke meeting coverage, please visit pactv.org/Pembroke. Sabrina Chilcott, Pembroke's Assistant Town Manager, will moderate the forum and will introduce the participants that are contributing today. Welcome, Sabrina.
Thank you very much, Julie. And I'm sorry that we weren't able to get together at 9 o'clock as we had planned. But the majority of the members who are going to be actually sit on the forum today actually didn't have internet connectivity. And we actually lost two of the participants because they were up all night and out on the roads. One of them was Jean Flamini, our DPW director, and Gretchen Emmets, our Council on Aging director. She's been assisting folks by phone and through outreach and in the field today. And as a result, I am very fortunate to have with us today John McKeown, the Executive Director of the Pembroke Housing Authority. Good morning, John. Good afternoon, John.
Good afternoon.
And of course, the esteemed health agent and co-emergency management director, Lisa Cullity, who is going to walk us through, hopefully, Lisa. When we left Friday, the emergency management team had a message for everybody, and it was a strong message. Came in Monday, felt pretty good about it, and then the storm came. Can you give us a little detail on that?
Yeah, because obviously we weren't having enough fun, so Mother Nature decided that we needed to have more fun. And as storms go, obviously this one's really windy. It did a lot of destruction, which is really unfortunate. But I think at the same time we are actually kind of blessed. It could have been so much colder out. The weather today could have been much colder and rainier, making cleanup and restoration much more traumatic. The large part of the town was out last night, over 75% of the town at the storm's peak. Many got it back at night before we went into the evening hours. Unfortunately, about half the town didn't get it back. And has come online chunk by chunk. The latest numbers I was able to verify was approximately 1/4 of the town, myself included, are still without power at this time. Those of us being fed by the quote unquote Hanson trunk, or the trunk line that comes East Bridgewater to Halifax and Hanson, had an estimated restoration time. About 5,000 customers were supposed to come back online. At first it was 1:30, then it was 2:30, 3:30, 4:30, so on and so forth. The latest is that line is going to be restored by 5:30. I know there's still some other catastrophic damage on the Elm and Taylor Street areas. I do not have verified information of if those are online yet or if they're coming back online. When will they come back online? Now, switching from the weather back to the COVID front, we had 3 new positive cases today. Tracking and information as we're looking at it does look like we are headed into the peak, and it looks like we're going to be starting to enter that peak probably this weekend.
Lisa, can you talk about the Be Smart, Stay Apart campaign and
Absolutely.
why, even after, and I get it, everybody who, they were doing their part and they were staying home and they were,
Yep.
literally spending time in their homes and in their yards, going out only for necessities, and then they lose power. So
Yeah,
there's
and
some folks who, go ahead.
No, and that became a really problematic point, and it's very wise of you to bring that up. It is so hard after a traumatic event like last night. I'm sure a sleepless night for many. To not want to go out and gather and socialize and go to the gathering points we always use, whether it be the local coffee shop or the supermarket or the convenience store, and start sharing stories and tales with our neighbors and friends. And I have to stress that unfortunately, as traumatic as last night was, we cannot stop acknowledging that COVID is here and that you need to stay apart. I mean, obviously, people need to check in on family members and make sure they're okay. That should be done by phone, not in person. Just because we had last night's events, unfortunately, COVID didn't take the night off. It's still here. It is still looking to transfer from person to person. I heard concerning stories about abutting towns where people were going into coffee shops, 10, 15 people at a time. And that's really dangerous. So I would stress to people, don't lose perspective of all the hard work we've done after the last 4 and 5 weeks. And I know people were dying to get out today, and it's wonderful to get out today, but don't get out together in groups. Get out solo, go for a walk, go for a walk with just your own family in your own housing unit. Take advantage of the beautiful weather, but do not congregate. It's putting yourself and your family at risk.
Before we rope John in here, question for you about DPH and any heads up they're giving you on
Yep.
surge timelines. Do we
Yep.
have a reasonable expectation regarding the April 20 loose window, next 7 days? Any
Yep.
more information coming out?
No, there's no new information. It is now looking like right around the 20th, as the governor alluded to on Friday. It looks like that number is holding. Numbers in communities that have always had a problem and been a little bit, unfortunately, ahead of the rest of the state are starting to see those numbers escalate. So I think the governor's original estimation, DPH's original estimation, that it was going to be between the 10th and the 20th. And then, of course, the governor amended it to say that it was going to be closer to the 20th. It's looking like that number is right. I hope it's not. I hope it's later than the 20th, because as I've said before, every day we go later into the peak means less of a spike we're going to have. But right now, based on the information we're seeing and based on the moves that DPH is making, it does look like it's coming, and it does look like it's coming, around this weekend, very early next week.
Thank you. All right, John, you and your staff have been working overtime and around the clock. You've tried to put a lot of good protocols in place at all of your facilities with the Housing Authority. Can you explain some of those and how they affect maybe visitors, residents who are there?
Sure, Sabrina. They continue to be, resolute, very disciplined. The population that we house and care for is, doesn't need to really be told more than once what to do and how to do it. Having said that, the protocols include the town guidelines, the states, and even the national message of staying 6 feet apart. We've also got a good message out, and it's been met with a good, proper response by the residents to not invite guests and to discourage those that want to come and see their family members. We understand it. But they're doing a good job at keeping people at bay because, of course, Lisa said the virus is still here and it's looking for another vessel. It's looking to move to somebody else. So the residents are pretty disciplined, staying apart. For the most part, they're sheltered in. Guests that do come are the only ones that were really, not dissuading from coming to the premises are those that provide, they're the healthcare professionals or allied professionals such as nurses, PCAs, homemakers that do laundry or do shopping. But what our residents do is they come down and they meet these outsiders as they come in at the main door and then bring everything back to their home. The nurses and PCAs, and any visitor that comes in, it could be a family member that's also a caretaker. They do wear gloves and they do wear a mask. And so people they're following the orders and the best sound practices. The staff, admin, for the most part, is working remotely, coming in, getting info that have to get to keep their effort moving forward. And as you said, Sabrina, maintenance continues to work around the clock. If it wasn't enough doing this awesome task in front of us here, we got this storm last night. And, the power outages didn't miss us. We sustained a long-term in the Bryantville area outage that is very difficult to sustain, especially now and especially when people are at their most vulnerable.
Now, I have a question. What about these common areas in the common buildings? That's a lot of times where I think your folks have gone to get charged to find generator covered areas. How is that working right now for you? And what limitations do you see?
Okay, excellent question. The community buildings that we have at each of the 3 primary developments in town for the elderly and the disabled, those have a kitchen, they have a gathering area, 2 of which have a mail room, all of which have laundry areas. So we've closed off the community room in general for any usage, with the exception of use for the laundry room and access to your mail. if you indeed are at a development that receives its mail at the community building. People are still mindful and respectful of the distances. We have little subtle reminders and some notices that are less subtle but very direct, which is what the population really likes to see. They want the instruction, they want the direction, and they follow the rules. So the community buildings are only used now for laundry and mail access, and that's it.
Now, do you have any power, when you had power issues, were there alternative charging areas for some of the folks who were impacted?
Well, as many are aware, Pima is very much ahead of the storm. And this storm that came yesterday prompted us all yesterday morning to put out directives and memos. And so I notified every single resident at their doorway with instructions to charge all devices ahead of time, that this coming storm will hit us. More than likely, we will sustain an outage. And residents were by and large all prepared. So any medical devices, iPads, iPhones, etc., seem to be fully charged. And the feedback that I got from the residents is that they were prepared in that respect. So the only one thing that was had me running a little scared was if it was a long sustained one and then not allowing access to a community kitchen where they can prepare a hot meal. But right now, the concentric approach is it's a matter of life and death. If I'm going to miss a hot meal, I'm going to miss a hot meal if it means staying alive and beating this.
Now, Lisa, back to that point, folks have to, understand and work within those guidelines for their own best interests and the interests of their families. What kinds of guidelines and additional benefits would folks going out who needed to grab quick groceries or something else, maybe to bring to someone that they know who's shut in or cordoned off, sectioned off? We've talked about facial coverings. As far as regular average Pembroke people going out and about, getting gasoline, going to the grocery store, what is the sort of guidance that's being given?
Sure. So actually that came up on the DPH call today as well. So the average person is going to be very well served and served just fine by your average cloth facial covering. And the facial covering you wear is not for your benefit. The facial covering is for the benefit of everyone around you so that you don't breathe on them. The other thing is you want a facial covering on yourself so you don't breathe on other people. But when we start talking about a population like housing or others that might have some more seniors, some people that are more susceptible, we also want to consider the items we bring them. We want them to be as sanitary as possible. So if you are shopping for someone who is susceptible, we're going to want to make sure that you're cleaning your hands well before handling those items, possibly considering gloves, possibly spraying those items if they're all sealed with something like Lysol to make sure there's no germs on them. You're going to want to use things like fresh grocery bags so that there's not contaminants on them. Or if you're using reusable bags to take groceries to someone like that, you're going to want to make sure that they're washed each and every time. We're lucky that this germ is very easily killed with soap and water, and that's a great thing. So all those things are going to be important. And going back to what John was saying, it is hard, especially on an isolated population such that he serves, that is used to being able to, and we've all, made reference to this in the past when there's been massive power outages and other horrible things that have happened around the community, that those gathering rooms have been a place for that community to come together and support each other. And it is really hard on a population like that to suddenly not have that resource available to them. However, John's point is correct. It is literally a matter of life and death. Should someone decide to go into community setting and gather in a group that large, they could actually be gambling with their life. So they have to not do that. And if it means, like John said, not a hot meal, if it means a PB&J, then so be it. That's what it has to be, because gathering is a far worse threat than not having a hot meal.
That's true. That's an excellent point. Now, I did want to take a minute to thank PACTV and specifically Julie Thompson, who has done such an amazing job for the town of Pembroke in facilitating and hosting these meetings for us. And Julie has the connections to the public and to the Pembroke info at pactv.org question line. And I wanted to see if Julie could join and bring forward any questions she might have.
Well, thank you, Sabrina, and it's really a group effort here at PACTV. It's certainly not me; it's all of us. But thank you, that we appreciate that, and we're happy to be able to do this every day. We did get a couple questions. One gentleman did ask about the property taxes. He definitely cannot pay it by May 1st. Will there be a penalty if he cannot pay it till July 1st?
Okay, so the selectmen started to take up that issue today in concert with advice and guidance from the accountant. And he brought forward some concerns that the assessor and that the treasurer have. The selectmen are going to have a special meeting outside their regular meeting schedule on Tuesday, the 21st, to have this conversation in depth. They did not vote today. It has a lot of ramification for the town and for the residents either way. So I would encourage any person who has concerns like that to reach out to the treasurer's office. She can be reached by calling 781-709-1417 and having a conversation with the treasurer collector about a tax bill that may be due and coming up very shortly.
So
But
individually,
it's a good question.
people could call individually and kind of explain their situation.
Absolutely.
Okay.
I encourage it. I mean, right now, again, the town, it's unprecedented times. And the Board of Selectmen has to actually take on board all of this guidelines from the acts of 2020 as passed by the governor. This section 10 and 11 that's coming up for a pretty intense debate is going to have significant financial impact to the town overall, and the ability to budget for the remaining FY20 cycle and FY21, which could have impact to services that we offer to all residents. But there's no doubt that people who are filing for unemployment may have lost their jobs, have rental concerns, mortgage concerns. They are going to have some specific and unique tax questions and collection questions that they should bring forward. They should feel free to bring it forward. The treasurer collector runs an amazing office and will talk to anyone, anytime. And I encourage everyone who needs to really reach out, and let's see if we can't partner with everybody and find some solutions that work.
That's great. Thank you, Sabrina. I'm sure that will make people feel good too. Also, this one probably for Lisa. There's talk, well, there's not talk, but the governor and the governors of a number of our surrounding states have kind of joined together to decide some kind of a plan for a slow reopening of particular parts of all of our states. Can you give any kind of update on that at all?
No, we've not received any kind of official communication. For us, it's still all the same restrictions that we've had in place for weeks now. I think it's wise to plan a reopening plan. I think it's too early to talk about a reopening date or what that's going to look like. We haven't even seen the peak of our event yet. And I think that Governor Baker's done an excellent job reiterating that to people. It's too soon to talk about opening things, but it's not too soon to have a plan. Because by having a plan, it means that when that time is there, instead of trying to figure out what to do, a template will be in place. I think dates, it's too soon, but I think having a strategy that is in concert with our surrounding states is obviously a very wise idea. Because if someone goes, open for everything instantaneously, it'll have ramifications on every state around it. So I think it's really wise that something's being done as a team approach with a slower rollout than just kind of like, game on, which I think we could see, like they're seeing in China, some return of the virus.
Right. Okay. Absolutely good advice. So, in keeping with what the governor thought between up through the 20th as being probably the peak, that's the point in time where we need to hunker down more than ever for the next week or so. Lisa, is that true?
I think it's going to look a lot more like 2 weeks, unfortunately. Okay. Based on what we saw in New York, based on what we saw in Italy, it seems that peak is pretty darn close to 14 days long. Obviously, everyone wants to be really careful. Obviously, the big deal with the peak is we don't want to overwhelm the healthcare system. Everyone thinks this is about not getting it or somehow avoiding all of this. It is going to roll through a large part of the community. It's about making sure there's not so many acute cases that the medical system and the hospitals we have can't respond to them with the equipment that they need to give those people a chance at life. That's what this is all about. Keeping that number manageable so that the people that need acute care are getting it and have the best shot they can of surviving. Having said all that, the sad reality is not everyone will survive. The sad reality is the mortality rate from this versus cases seems to be, very high. And I think that the idea is we want to minimize that as much as possible by stretching it out so everyone gets the care that they need.
Great, thank you. You're right. And I did want to bring up the town's website. It's a
Yep.
one-stop shopping here for everything you need. And like this morning, this whole situational update with the windstorm came out, and a number of paragraphs came out about what happened, what was being done, etc., which is really, really, really helpful. And you also have, of course, updates at all times on this. So does somebody want to talk about the website?
I'm glad you asked, Julie, because the emergency management co-directors, we have the most amazing team of people in Pembroke. I was delighted to know that as a resident, that my family and my security is in very good hands. We have a big team of stakeholders, they're department heads, but they're really well organized by this three-legged stool. The police chief and the fire chief rolled in the health agent to be that third support structure in a health emergency and a declaration of emergency. These are the people who work with the Council on Aging director, the Housing Authority director, the library director, the recreation director, the town manager, the board of selectmen, the DPW director. I mean, some of these people need to be in the field, and some of them have opportunities to break away, come in and have these updates and make these decisions. So one of the things that we can do to support the directors is we can try to improve and extend communication. So the library director, Deborah Walsh, has done an amazing job with the website. She did a complete redesign through Virtual Town and Schools a few years ago. And if you remember, the product before was still a beautiful website, but this is very intuitive and streamlined, sleek design. It's easy to find things. The search bar takes you where you need to go. And by exploiting technology and really running it to its best capacity, we can minimize man hours. And if we are consistent with delivering a message, same time, every day, let people know their team's working, they're there to support them, and the information is as fresh as it possibly can be once it's actually put through that cycle every morning at 10 o'clock of being vetted by the entire team. So the website was a labor of love. We thank Deborah Wall for that. A couple of us do jump in to help her because it's a big task. But again, it takes a team to do something like this.
Sure does. And that was really well said. And if we can put up the website once more for my team in the control room there. If you click on this red banner, as Sabrina talked about, and scroll down, anything and everything you'd probably need to know is here. It's just like you said, Sabrina, it's incredibly well done, all kinds of resources. It's just terrific. Thank you so much. Those were all the questions that I had for today, Sabrina. I'll just bring it back to you for any final thoughts or comments until we meet again on Thursday morning.
Thank you. But before we go, there was one other question I really did want to bring to John. And John, you're on mute, so you got to get off mute to answer the question, okay? You have some of our most precious community members in the elderly and the disabled and the people that we support and that we concern ourselves with regularly to make sure that that support is there with them, right? And a lot of these folks who live with you at the Housing Authority have part-time jobs. They were involved, they were out making money, they were going back and forth, and some of those folks just aren't working right now. So before we actually do some final thoughts, I wanted to ask you, how are they doing? How does their new unemployment status affect their rent? And what can you tell us about that?
Well, that's a great question. And it is quite a blow for them to, one, have to shelter in and lose that whole social connection that they've all had the benefit of and the privilege of working. I mean, it does a lot for these people. We have upward of almost 500 residents or people, families that we house. They're not just elderly and disabled, but family members with our voucher holders all over the state. When they lose a job, you reach out to us. We have program coordinators for each of the programs, state, federal, elderly, disabled, or family, or a voucher recipient. And what we'll do is an interim adjustment to their rent. Certain protocols to go through, paperwork to get, but we will adjust the rents right away. We have guidance from the state and from HUD to be able to do this remotely and to help them on the very first day of the next month. And every day we hear from tenants or recipients, voucher recipients, that they've lost their job or they're unable to work because they're positive or they need to shelter in, take care of a family member, etc. But it's an excellent question. And just like the town at large is working with people on their real estate tax bill, etc., we have a plan and a process in place that we can help them and accommodate that change.
I know that was a concern, and I'm really glad you're there to take care of that and to really take a look. And now, John, as a last thing, just because this is your chance, by the time we get back together next Tuesday, it will be the 21st. You know, I mean, we're going to be in a different landscape. What would you say as final words coming out to not only your own clients and the people that you take care of, but to everyone?
Well, I think that they have to stay 6 feet apart. People have to be mindful and respectful of everybody's solitary world and don't step into it. As much as you love them and you need to be with them or you need to see them, do it remotely. If you're a caregiver or a provider, bring those on wheels. Please be respectful and mindful. Wear gloves, wear a mask, meet your the person that you visit at the first floor. Please just bear with us. The hard work is done. We've gone through so much for the last 30 days that 2 more weeks, just be vigilant and hold the line. We'll do our part and ask that you do yours.
Very good, John. Thank you. Lisa, this is an opportunity. It's an opportunity to not only remind us to wash our hands, please, but to also, because again, you know, you're going to be available to the team for the Thursday update, I believe.
Yes.
That's a much more clinical breakdown. This is a more open and approachable societal kind of a format. This is an opportunity before we really see what that turn looks like. Get that word out there. Go ahead. Thank you.
Don't mess it up now. All joking aside, it's not over. This was never a sprint. This was never a half marathon. This was always a marathon. And if not, it might have even been an ultra marathon. And for those that aren't familiar, that's 2 marathons back to back. This was never going to be one in a day. This was never going to be one in a week. This was never going to be one in a month. This is something that's going to be a multi-month event. I'm hoping it's over by middle of summer. I think it's still going to be there in our rear view mirror. I think the effects are going to be felt for a year, if not longer. But please don't back off now. Please don't be sloppy in our behavior now. Wash your hands. Be hyper vigilant. Keep up that personal hygiene to a high level. If you're out in public, wear that facial covering. Stay 6 feet apart and wash your hands. It's not over. It's just starting. I know it feels so long, but if we don't do all these things, it's going to be even longer.
Thank you. And just to clarify one last time, we always knew that we were staying at home through May 4th. That was never really unknown. When the governor extended that order, we knew that. While it's been uncomfortable and things like yesterday's storm was brutal on the psyche, brutal to people at home, we always knew we had to find a way to make it to May 4th at the least. And hopefully that really is where we get to start having the other kinds of conversations. But for right now, to Lisa's point, that don't mess it up now. People have come so far and have already done so much that as we move into the next 7 to 10 days, 14 possibly, we really do need to keep all of those measures in place. We need to be smart and stay apart. And I really want to thank you guys for coming out. I know it was a very long night. I know it was a very long day.
Not at all.
Thank you.
Not at all.
Thank you very, very much.
Thank you.
Thank you.
All right,
Sabrina.
Julie, will you sing us off?
Yeah, thank you so much. And just keep in mind that we date stamp these every day because information changes every day. And always be aware when you're watching one of these on replay and you go to packtv.org/Pembroke to watch any of the Pembroke forums on replay. Know that the information you're getting is accurate as of that date, and things can change. We will see you again Thursday morning at 9 o'clock with Sabrina and her whole crew. And we ask you to please social distance, please stay positive, please please wear something on your face when you leave the house for everybody's sake, and we will get through this all together. Thank you.